Hello everyone, this is Tiffany Jensen Williams and I am coming to you live from South Portland, Maine. I am here to discuss a case study about a young man coming home from college who unfortunately has the flu. I'm going to try and keep this short and sweet, and I appreciate you guys taking the time to listen to it. So Landon is a 22-year-old Caucasian male. He is coming to my office with 36 hours of flu-like symptoms. His mom wants him and his 18-year-old brother started on Tamiflu, but I am going to not talk about that here because I have a slide specifically geared towards that. Past medical history of asthma that he's had for the past 10 years, normally well controlled, but he has been having to use his rescue inhaler several times since yesterday. His current medications include a Flovent inhaler as well as albuterol. The Flovent is a corticosteroid that is prescribed for his asthma. Albuterol is a rescue inhaler that he should have on him at all times. It's also a SABA, or short-acting beta agonist. Social history. So he's currently on winter break from college. He's just finishing up his senior year. He's got one more semester and then he will be graduated. Living with his mom and younger brother. He does not smoke, use illicit drugs, and he drinks occasionally. Overall, he is a pretty good guy. Assessment. So I broke this up into two sections, subjective and objective. Subjectively, he woke up yesterday morning complaining of fevers, chills, sore throat, cough, had pounding headache, some nasal congestion, body aches, fatigue, and shortness of breath. All pretty standard symptoms for the flu, minus the shortness of breath, but he is asthmatic, so that explains that. Objectively, vital signs, he's got a pretty high temp, a little tacky, his respiration rate's up, otherwise his vitals are okay. Labs, he came back positive for the influenza A on the rapid influenza test. Physical exam, he's slightly tacky, regular rhythm, lungs definitely heard some expiratory wheezes. Throat was red without streaking or patches. So the plan that I have come up with him is to reiterate to him several times to stay hydrated. Fluids are your friends. I remember hearing a old saying that says feed a cold, starve a fever. So basically, if he's nauseous or not terribly hungry, that don't worry about it, just stay hydrated. He wants to have plenty of rest. Sleep is your friend when you have the flu. And I mean, I like to sleep normally, so when I don't feel good, I definitely want to sleep. Tylenol, ibuprofen. I had the flu earlier this year, and my provider recommended taking both. Tylenol for the fever, ibuprofen for the body aches. I would probably do the same. If they didn't feel comfortable doing that, he could alternate it or take one or the other. I would prescribe him Tamiflu. He's within that 2-day range of starting it, and I will talk more about that on the next slide. And then obviously use his rescue inhaler as he needs to, because most likely his asthma is going to be kicked up a notch with having the flu. So Tamiflu, indications for use, it's used to treat symptoms caused by the flu virus in people who have had the flu symptoms for no more than 48 hours. So he's just squeaking in that window. It can lessen the severity of symptoms and shorten recovery time by 1 to 2 days. Him being asthmatic, it's pretty important for him to try and be healthy sooner rather than later. Does not prevent bacterial infections that may happen with the flu. Also, being asthmatic, he is more prone to pneumonia post-flu, so that's something to keep in mind during the follow-up period. It's not recommended for people with end-stage renal disease that are not on renal replacement therapy. It's not a substitute for an annual flu vaccine. That was in bold on the Tamiflu website. And obviously do not take if you are allergic to any of the ingredients in Tamiflu. The mechanism of action inhibits influenza neuraminidase. I have no idea if I said that right, but it basically decreases the viral load. So in theory, that's what lessens the duration by 1 to 2 days. Teaching plan for Landon, I would tell him to take the Tamiflu twice a day for 5 days. It's prescribed. I would prescribe him the 75 milligram dose. I think it does come in 45 milligrams. I would suggest for him to take it with food because that would decrease nausea, which is one of the main side effects, nausea, vomiting, as far as common adverse reactions. I would educate him on signs and symptoms of serious adverse reactions like delirium. I know he's 22, but teenagers, it's been reported that they have self-harm behaviors or can have it. And then anaphylaxis, Stevens-Johnson syndrome, and toxic epidermal necrolysis. So pretty rare for those, but I would still want him to be made aware of what the signs and symptoms are and to either call the office or, go to the hospital if he's having any of those symptoms. Lastly, this lovely lady is Susan. That is Landon's mother. And then the boy is Mike. He's the 18-year-old brother of Landon. And they are on this page because, lo and behold, Tamiflu can also be given as a prophylactic to essentially stop people from getting the flu who have been exposed. So dosage and frequency is a little different. You would take 75 milligrams once a day for 7 to 10 days. Can be given up to 6 weeks, say if there's an outbreak in the community, like in a nursing home or something like that, which I found pretty neat. I had no idea. Caveat being that it can be pretty pricey. I saw on GoodRx that a 10-pack costs on average about $50. So I would ultimately leave the decision up to Landon's mom if she wanted to have a prescription for her son and or herself, since they've both been exposed to it. Yeah, so I would offer them that, in theory, they are both my patients and I've taken care of them in the past and I know their past medical history, so I feel comfortable prescribing it to them. Anyway, so that is my case study. Poor Landon has the flu and is going to be miserable for the next couple of days, but hopefully with the Tamiflu he will be back to his old ways sooner rather than later. Here is a page for my references, and again, thanks for listening, and have a great rest of your summer.